Okay, in this video, we're going to go over a drill to make sure that the calves, hamstrings, and the glutes are all firing together in a more neutral or slight posterior pelvic tilt of the pelvis. This is really important to not only start in a very supported position, but to progress over time. But this is where we start. So you're going to lie on your back with your feet on the wall. So I want equal weight distribution on your feet, and I want them to be the same width, same height on the wall. Be very particular. And I want there to be a slight bend in the knees, depending on how much room you have. I'm kind of maxed out here. So what you're going to do, first cue I want to talk about is the feet. So I want a slight push down on the big toe, maintaining that. And then keeping your feet where they are, I want you to picture you dragging your feet down. So this is going to kick on the hamstrings, and also naturally your butt's going to clear off the ground. So instead of being in this anteriorly tilt position, this naturally starts to tuck the butt, more of a neutral position, and you're holding it here. Once you're there, go ahead and clear the heels off the wall. And ideally, first you want to get this down packed. So you want this to be felt in the hamstrings, the calves, the glutes. And once you can hold this for 30 seconds without pain and without losing form, you're going to progress where you offload one side, one knee comes up, and you should definitely feel more firing on this side to maintain, since all of your effort is going to be on one side. Start with 15-second holds. If you're able to do 30, that's great. When you start to feel fatigue, you're going to feel a shake eventually. So after 30 seconds, you're going to switch to the other side. You don't want to have pain with this. If anything, you should just feel lots of effort. If you feel as though things are going to start cramping, go back to doing it with double leg and progress over time. Just be patient with yourself. But otherwise, ideally, 2 legs simultaneously, holding for 30 seconds with good form, progressing the single leg up to 30 seconds. It's okay to start with 6 seconds, 15 seconds, whatever you need to make sure that the form is good and that you're not cramping.